Hi everyone, I'm Sir July, and for this slide sets, we will be discussing the non-specific body defenses against infection. The immune system is a collection of organs, tissues, and cells that together perform a vital function of safeguarding the body from pathogens. The human defense is composed of non-specific and specific defenses. The focus of this presentation are the non-specific defenses. The non-specific defenses are the natural, built-in body components that destroy all types of foreign substances. One of the keywords there is the word natural. It means innate or we are born with it. Let us also emphasize that it destroys all types of pathogens, be it virus, a bacteria, or a helminth. In some references, there are actually three lines of defense, with the first and second lines as non-specific defenses. The first line of defense is surface protection, composed of anatomical and physiological barriers. They prevent pathogens from getting deep inside the body. In summary, the first line of defense is the external innate defense. The second line of defense is the internal innate defense that confronts pathogens that make it past the external defenses. According to Koshir, the intact skin and mucous membranes are the body's first line of defense against microorganisms. Unless the skin and mucus become broken, they are an effective barrier against bacteria. Fungi can live on the skin, but they cannot penetrate it. There are several reasons why the skin is an effective barrier. For one, the dryness of the skin is a deterrent to bacteria. Bacteria are most plentiful in moist areas of the body, such as the perineum and the axilla. Resident bacteria of the skin also prevent other bacteria from multiplying. They use up the available nourishment, and the end product of their metabolism inhibit other bacterial growth. Normal secretions make the skin slightly acidic. Acidity also inhibits bacterial growth. As entering air follows the tortuous route of the nasal passage, it comes in contact with moist mucous membranes and cilia. These trap microorganisms, dust, and foreign materials. The eye is protected from infection by tears. Tears wash microorganisms away, and tears contain inhibiting lysozyme. So the next time someone catches you crying, just say, I'm just cleaning my eyes. Each body orifice also has protective mechanisms. The oral cavity regularly sheds mucosal epithelium to rid the mouth of colonizers. The flow of saliva and its partial buffering action help prevent infections. Moreover, the saliva contains microbial inhibitors such as lactoferrin, lysozyme, and secretory IgA. So when someone catches you drooling over him or her, make the lamest excuse that you're just producing IgA. The high acidity of the stomach normally prevents microbial growth. The resident flora of the large intestine help prevent the establishment of disease-producing microorganisms. Peristalsis also tends to move microbes out of the body. In the genitourinary tract, an intact mucosal surface also acts as a barrier. Urine flow has a flushing and bacteriostatic action that keeps the bacteria from ascending the urethra. The vagina also has natural defenses against infection. When a girl reaches puberty, lactobacilli ferment sugars in the vaginal secretions, creating a vaginal pH of 3.5 to 4.5. This low pH inhibits the growth of many disease-producing microorganisms. As previously mentioned, the second line of defense, or the internal innate defense, confronts pathogens that make it past the external defenses. This defense includes the phagocytes, antimicrobial proteins, and inflammation and fever. Phagocytes are cells that ingest microorganisms, dead cells, and foreign particles. Phagocytes include monocytes and macrophage. Monocytes are found in blood, and monocytes differentiates into macrophage in tissues. There are several macrophage in various organs. In the liver, they are named Kupffer cells. In the brain, we have the microglia, and in the lungs, they are simply named alveolar macrophage. There are a variety of antimicrobial proteins that serve as second lines of defense. Interferons are substances produced within the cells in response to viral attack. Lysozymes destroy mainly gram-positive bacteria. Prior to this presentation, did you know that inflammation is actually a line of defense? Inflammation destroys or dilutes the injurious agent, prevents further spread of the injury, and promotes the repair of damaged tissue. There are three stages of inflammation. The first stage is the vascular and cellular response. The second stage is the exudate formation. And the third stage is the reparative phase. The classic signs of inflammation that we know are actually formed during the first stage of inflammation. These signs are pain or dolor, swelling or tumor, redness or rubor, heat or calor, and impaired function or functiolasa. Fun fact among Harry Potter fans out there, J.K. Rowling chose the name Dolores Umbridge to reflect her character. Her first name comes from the Latin word for sorrow or pain, dolor. So, how do these signs come about? In the first few seconds following injury, there is a transient arteriolar vasoconstriction to control any blood loss, followed by arteriolar vasodilation to enhance blood flow in nearby capillaries and tissues. The dilation of small vessels occur as a result of histamine released by the injured tissues. Thus, more blood flows to the injured area. This marked increase in blood supply is referred to as hyperemia and is responsible for the characteristic signs of redness and heat. Of the five signs of inflammation, therefore, it is redness and heat that come first. Vascular permeability increases at the site with dilation of the vessels in response to cell death, the release of chemical mediators such as bradykinin, serotonin, and prostaglandin, and the release of histamine. The increase in vascular permeability will result in the leakage of fluid, proteins, and WBCs into the interstitial spaces. This event results to swelling and pain. Pain, therefore, in inflammation is a result of the pressure of accumulating fluid on nerve endings as well as the irritating chemical mediator bradykinin. The pain will result to loss of function. That is a simplified, easy to understand explanation for inflammation. Now, let us summarize. Human defenses are divided into non-specific and specific defenses. Non-specific defenses are natural or innate, and they destroy all types of pathogens. The first line of defense is surface protection and is also called external innate defense. It includes the skin and mucous membranes and the secretions of the skin and the mucous membrane. The second line of defense is the internal innate defense. It includes the phagocytes, antimicrobial proteins, and inflammation. Pause this video, gather your thoughts, and when you are ready, let us have a practice test. Which of the following is true of non-specific defense? A. Not innate. B. Destroys all types of pathogens. C. Includes first, second, and third lines of defense. Or D. All of the above. You have 5 seconds. A is wrong because it is innate. C is wrong because it includes only the first and second lines of defense. So the answer here is B. Destroys all types of pathogens. Which first line of defense takes advantage of low pH? A. Skin. B. Stomach. C. Vagina. D. All of the above. You have 5 seconds. Low pH means acidic environment, which is advantageous for the skin, stomach, and vagina. So the answer here is D. All of the above. Substance produced within cells in response to viral attack. A. Lysozyme. B. Interferon. C. Histamine. D. Bradykinin. You have 5 seconds. If you answered B. Interferon, you are correct. And lastly, The irritating effect of bradykinin will result to which sign of inflammation? Is it A. dolor, B. calor, C. rubor, or D. tumor? You have 5 seconds. And the answer here is A. dolor. If you got 4 questions correctly, you did a good job. If not, rewind this video to check your answers. This ends the slide set. Please do not forget to subscribe to my YouTube channel, Memory Aid Nursing. Thank you.